Welcome everyone to Orange County's Asian and Pacific Islander COVID-19 response. What's happening and what's next? This town hall is brought to you by an amazing group of coalition members, and we're here to talk to you about what's happening in Orange County around COVID-19 and the Asian American and Pacific Islander communities. I'm Mary Ann, and I'm the Executive Director of OCAPICA, as well as a member of the Asian and Pacific Islander Task Force for COVID-19, and I'll be your moderator. And I just want to thank you all for joining today. We really appreciate your interest and support and understanding regarding COVID-19 response. Before I introduce our excellent panel of speakers today, I really want to thank our partners for this event. And we have a number of organizations that have planned this event, this town hall, and just to inform you of what's happening. So the first organization I really want to thank is Orange County Healthcare Agency. And the Healthcare Agency has been so supportive and really looking at how to address disparities in health with our communities. So thank you to the Healthcare Agency. I'd also like to thank Korean Community Services, Southland Integrated Services, the Cambodian Family, OCAPICA, Asian Americans in Action, OSET, the Orange County Civic Engagement Table, the UC Riverside AAPI Data, the Orange County Love Coalition, and the Orange County Asian American and Pacific Islander Meet and Eat Coalition. And finally, a big, huge thank you and shout out to one of our critical organizers of this event, the Coalition of Orange County Community Health Centers. And I'd like to invite CEO Isabel Becerra to be able to say a few words to us today.
Great, thank you, Mary Ann. Thank you, everyone. Again, my name is Isabel Becerra. I am the President and CEO for the Coalition of Orange County Community Health Centers. We actually recently celebrated our 45th anniversary. We represent 25 community health center entities in the county who together operate 80 locations throughout the entire county and collectively care for 380,000 patients for whom they provide over 1 million healthcare visits per year. We are so excited to partner with two of our member health centers, already mentioned, Korean Community Services and Southland Integrated Healthcare Services. And of course, all of our partners around the table. We continue to work on mitigating the impact that COVID has disproportionately had on our vulnerable communities. And we hope to continue engaging in efforts that respond to specific API community needs in our county. So thank you very much. I now pass the floor back on to Mary Ann. Thank you.
Thank you so much, Isabel. We really appreciate it. We appreciate your leadership and the coalition's leadership. Next, I'd like to introduce our excellent panel of leaders who are going to be discussing Asian American Pacific Islander COVID-19 response. They're going to be talking about what's currently happening and what we need to do next. Our speakers are key leaders in healthcare, research, and civic engagement. And all three areas are needed to address COVID-19 in our communities. I'll briefly introduce the speakers and their affiliations, but want to save as much time for them to speak, so I won't go through their entire bios. But at the end, we'll also have some time for questions and answers. So the first speaker that we have today, we're so honored to have him and really truly lucky to have him, within the healthcare agency. And that's Dr. Clayton Chow, who's director of the Orange County Healthcare Agency and County Health Officer. After Dr. Chow, we'll have Ellen An, who's executive director of Korean Community Services, one of our local and leading federally qualified health centers. After Ellen, we'll have Dr. Karthik Ramakrishnan, who is the director of the Center for Social Innovation and Asian American Pacific Islander Data and a professor of political science and public policy at UC Riverside. Then we'll have Priscilla Wong, who is a senior attorney and board member of Asian Americans in Action. And then finally, Jonathan Paik, who is executive director of the Orange County Civic Engagement Table. So this lineup of speakers is superb, and we're so excited to have them here today to talk about our COVID-19 response, what's going on in the community, and what we should be doing and taking action. So I'd like to hand the floor over to Dr. Clayton Chow.
Thank you so much, Marian Fu. Hi, everyone. Welcome to an important conversation today. And that's my intention, is to have a conversation with all the other excellent speakers on the panel as well. First, I would like to thank the coalitions as well as the API COVID task force. At the healthcare agency, we strongly believe in community collaboration. I mean, without the collaboration, without working together, private, public, faith-based, and community-based organization, we won't be able to collectively have a strong impact on our community. And so I personally strongly believe in this type of collectiveness because without this, we'll never be able to move the needle as it's related to population health and healthcare inequity. So thank you so much for an opportunity for the healthcare agency to participate and join in this effort. So let's jump right into it. I thought I'll give an overview of what's happening with COVID in Orange County from a public health perspective, and then I'll just highlight a few works that we have been moving the entire county, of course, with the collaborations of all of our community partners. So since February of this year, as you know, we have been in a whirlwind of everything from science to physical health to mental health to financial, economic health as an impact of this pandemic on our community, specifically here in Orange County, but as you are well aware, worldwide. And so Orange County has a population of about 3.2 million folks, as you know. Up until yesterday, the total number of people who tested positive that we know of in Orange County is now 50,974 folks. And when I say that we know of, is because we also know that there are people who are walking around in our county positive but asymptomatic, and therefore have not even thought about testing. With that number, is inclusive of 1,093 individuals who have passed away from COVID or COVID-related illnesses. The highest age group that are tested positive currently in Orange County is between the age of 25 and 34. And the slow growing group is the age of 17 and below. And as we know, next week, when Orange County is allowed to reopen school K to 12 for in-person education, we are expecting that there will be outbreak and there will be infection in this age group. Although we know that all of our schools in Orange County, public and private, have done a fantastic job in preparing the school condition, preparing the students and parents, as well as preparing their staff for the reopening of a school. And we know this last few months of lock at home and online education have been very difficult on our children, especially those children with a special need because they needed that extra in-person hands holding. We know that the lock-in had an effect on our children, but we also are very aware of the transmission rate because community transmission is still occurring, as well as the risk that it would pose on our teachers and staff who are part of the vulnerable community. This infection has disproportionately affected our Latinx community. As you know, our Latin community is 35% of the total population, but yet the number of people who are positive is over 46%. Native and Hawaiian, especially Pacific Islander, which comprise of 0.3% of our population, but yet make up to 0.54% of folks who are infected. Now, Asian, on the other hand, we are 21.1% of the demographic in Orange County, but our positivity rate is about 8.15%. We do know that perhaps that number is low because there has not been a very concerted effort in testing in the Asian community, and specifically this issue around stigma of being carrying the label that you're positive for COVID-19, as well as the other barriers around testing that I know Ms. An is going to get into. As is related to death rate, 72% of the death cases in Orange County are in the individual over the age of 65. Again, we do see the disproportionate affecting the Latinx community. Again, the demographic of Latinx community is 35%, but yet the total number of people who have passed away from COVID is 44.6%. I mentioned earlier the infection rate, the positive rate in the Asian community quite low, 8.15% compared to our demographic percentage. However, when you look at death, the same demographic, 21.1%, but the percentage of death cases in Asian is 17.8%. So while our infection rate is low, but our death rate compared to the infection rate is disproportionately higher. Mention a little bit about testing. We have a network of what we call the county contracted testing sites, for which many of the community clinic in the coalitions is part of. We also have two super site drive-through test sites, one in Anaheim Convention Center and the other one which just opened a couple weeks ago at the OC Fair and Event Center. I know that we have had capacity have not been filled up, and we have been trying to encourage people to go get tested, especially people who are symptomatic, people who have been exposed, as well as people who even asymptomatic, but part of the essential and critical worker, like grocery worker, restaurant worker, teacher, etc. We know up and down the state, this last few weeks, there has been a trend of fatigue in terms of number of people who want to get tested. So we are encouraging our community to really and go get tested. For those who are symptomatic or people who've been exposed, truly the best way still be through your primary care physician, through your insurance, because it's more than just testing. You really want to have somebody who follow up with your care and with your health condition. But nevertheless, if you're uninsured or underinsured, or really don't have a primary care physician that you can identify with, then you are truly encouraged to come to our website to get tested. We're also working with the API task force to roll out a new testing strategy, which I know Ms. Ann is going to be talking about in a minute. We've also have gotten several sponsor collaboration with two entity to do surveillance. The first one is UCI. UCI have been conducting surveillance in the community, trying to figure it out from our general population who is infected and what is that infected rate. And UCI particularly looking at the different ethnic community as well as the first responder. We also have a study with Hope Hospital, specifically looking at the infection rate in the healthcare provider in the outpatient as well as inpatient setting, and also looking at different ethnic community. And I know both institutions has been advertising for this study, and I'm encouraging people to participate in those studies. As far as health equity go, about 2 months ago, we've noticed that there are 10 zip codes in Orange County that have the highest infection rate. And those 10 zip codes, unfortunately, or however you look at it, center around two cities, Anaheim and Santa Ana. And so we quickly work with a coalition of community partners, school district, government, and community clinic, led by Latino Health Access, and we started the Latino Health Equity Initiative in Orange County. What the coalition has done is bring testing into the neighborhood, particularly educating people about getting tested, educating people about what it means to be positive or when you're exposed, and what do you have to do when you need to be isolated or need to be quarantined. We have set up so the initiative also link people to necessary housing, temporary housing, motel for those who need to be quarantined or isolated but do not have a mean to do so. We've also have been linking people to the social determinant of health need that they have. And I'm happy to inform you that the initiative have been very successful. We're getting ready to release the report after 2 months. We have seen the number of the percentage of a positivity rate in some zip code as high as 20% has now dropped to below 10. So we know this kind of model really, really works. And that's why I'm so excited that we're going to move forward with the API task force in looking at a similar yet different model in targeting our community, especially making sure that people who, because of whatever reason, have not been avail themselves to test it would have the ability to get tested. I think all this month we've been talking so much about COVID, but we tend to forget that before COVID, there's one thing that we've been struggling as the entire community, and that is this whole issue of health equity. And when we talk about health equity, we have to talk about those common chronic health conditions that we see across all ethnic groups, but specifically in certain ethnic groups, and also across all community with a different SES level, but particularly people with low SES level. And those are the typical health conditions like obesity, diabetes, hypertension, etc. Because we do know that people who have a higher mortality rate and who are needing to be hospitalized longer, or who are experience more severe condition when they are infected with COVID, are people who have those kind of chronic health condition that are not being treated, not being paid attention to, and not under control. And so, my opinion that yes, we're working on COVID. Yes, we need to talk about COVID, but we also need to restart the community and talk about the health equity around those common chronic health that truly put people at risk for a higher mortality rate and and more severe condition when they are infected with COVID. And so finally, what I like to address with you is the issue around vaccine. You probably have heard the term trendemic, as the seasonal flu is getting close. We want to make sure that people are mindful that if any other year you did not get a regular seasonal flu vaccine, this is the year that you want to get it. Of course, providing that the flu vaccine is not contraindicated to your health condition and you have never had an allergic reaction to the vaccine. We strongly recommend everybody to go out and get vaccinated, because what we don't want to do is that people who have the seasonal flu, and yet because the symptom overlap with COVID-19 is so high that your primary care physician at any other year would say, hey, stay home and get well rested and drink your fluid and relax and what have you. This year, they might be more unsure and would advise people to go into the hospital, go into the emergency room, and therefore inadvertently bombard our health system. That's what we don't want to get, because then you bombard the system, and then there's less bed availability or less provider availability to take care of people who really need to be there because of COVID. And so please, if you never wanted to get the flu shot any other year, this is the year you want to get it. And so I'm asking everyone in your effort to go out and encourage folks to get their seasonal flu vaccines. With that, I'm going to stop here and pass it back to you. Thank you.
Thank you so much, Dr. Chow. We really appreciate it. And as you can see from the slide, here's the website you can go to for the Orange County Healthcare Agency to get more information on COVID. They have a great toolkit with education materials in various languages, as well as information on testing and the daily numbers of positive tests. So thank you so much, Dr. Chow. Really appreciate your leadership and your support in this. Next, we're going to have Ellen An, who's Executive Director of Korean Community Services, talk about how we're addressing COVID-19 in the Asian American and Pacific Islander communities. Ellen?
Hi. Good afternoon, everybody. I am speaking on behalf of the group of frontline responders here in Orange County, API community-based organizations and clinics, to update you on what's been going on and what will happen very soon here in this county to provide a proper response to the API community. Just a little history. Prior to the public health efforts that are ramping up very quickly, there has been work that's been addressing the API community needs. And I'd like to highlight just the amazing work that some of us have all done. Many of you are on this call to address COVID-19. First and foremost is the clinics, the community health centers have been testing for many months now the symptomatic API folks, primarily in Korean and Vietnamese, and are still marching along, testing hundreds of patients in language. And on the basic needs front, two significant coalitions gathered in the past 6 months. The first is the Love Coalition, Loving Our Vulnerable and Elderly, that has been distributing rice, soy sauce, Asian needs, Asian basic food staples, and other toiletries in a coordinated manner. And also the Meet and Eat group that has been getting together once a month, that really is a gathering of all the key API leaders and stakeholders locally. So in the past 6 months, there have been Herculean efforts by mostly small nonprofits trying to respond to the great need in our community. And about 2 or 3 months ago, in July, I believe, we began hearing of the Latino Health Equity Initiative led by Latino Health Access and some of the Latinx community-facing community health centers. And many of us began to wonder, what about the API community? And to the credit of healthcare agency folks came to us and said, we really should be doing something in the API community. The numbers aren't fully out yet because the numbers aren't as disaggregated as many of us would like. But we do know the Pacific Islander community has experienced a devastating impact. We also know our high percentage of healthcare workers, especially frontline nurses in the Tagalog-speaking community. And so we all knew we had to do something. We also know, and Dr. Chow mentioned the zip codes, although there are some, the overwhelming need was in Anaheim and Santa Ana, there are some significant zip codes in the cities of Buena Park and Garden Grove and other areas where there is a high Asian residential and business population. And this is not surprising given that COVID has disproportionately impacted the working class folks, many of who are API. So with healthcare agency and many community-based organizations leveraging the Love Coalition and the Meet and Eat group, things have been moving very fast in the past month. And there is now a concerted, collaborative, and coordinated response that is started in the past 2 weeks. And it is divided up into 3 separate projects that are in partnership with healthcare agency. The first is the API Task Force Outreach and Education Project. That is being led by our moderator, Marianne Fu's organization, Okapica, with partners, the work being executed by Pacific Islander Health Partnership, South Asian Network, Okapica, KCS, Southland, Asian American, AASCSE, Hope Community Services, and VACF, the Vietnamese American Cancer Foundation, and the Cambodian family. And collectively, we have deep reach into over a dozen and more Asian languages throughout Orange County. The goal of this project is to provide in-language, community-wide outreach, education, and linkages to COVID-19 resources, and to guide people. The county, I saw a link earlier, the county toolkit is very good right now, and much of it is available in the Asian languages. But we would like more to actually use it. And so in language trusted community partners will be out in the communities providing this sort of information and education. The second large project that will be going on is a patient navigation project with KCS leading. Again, the partners are the 8, 9 mentioned earlier. And this project is to provide patient navigation to testing sites. We mentioned the super sites. I was on a call a little earlier. The super site is at Anaheim Stadium and Costa Mesa Fairgrounds, but you ask your average immigrant, older Asian language speaking person, I don't know if they can exactly tell you where Anaheim Stadium is, but they will be able to tell you where their local Asian market is. And so it is to navigate folks to the super sites and the community testing network and the state run sites as best as we can by trained and trusted key community health workers. And it's also to provide community education because there is a lot of testing misinformation out there. And the final, which got executed today, actually, is to perform some testing. KCS will be leading this, and this will be working with primarily 4 partner agencies, as well as a lab partner, Kahala Biosciences and Vitae Diagnostic Lab. And it is to take mobile testing services into our community. It is testing that is in language, embedded, accessible, and in zip codes with high API residents or API businesses. And it is most likely going to start in the cities of Buena Park, Garden Grove, Westminster, and Irvine. This testing project aims to test thousands of essential workers, close contacts, and of course symptomatic individuals. There will be a website, a web registration page that will be from beginning to end in language in at least the 3 major Asian threshold languages. But it's more than testing. Dr. Chow mentioned the chronic conditions. We know APIs suffer from higher rates of certain chronic conditions. And so our intent on this project is to provide health education for comorbidities that put folks at higher risk of death through COVID-19. And so we will be focusing on all those high risk conditions mentioned earlier, diabetes, hypertension, etc. And we will also be providing linkages to primary care medical homes to make sure that folks who do test positive have a physician. What we do know in the API community is that there is a significant number of uninsured in our community, and so we want to make sure that they have a connection to a physician to monitor their symptoms and to know when to go to the emergency room. So that, in a nutshell, is the 3 projects that have started in the past few weeks. It will be collaborative. It's a coordinated response in partnership with HCA. And this is just beginning, but we see this collaborative and coordinated effort as really developing a health platform to address some of the other emerging issues that we know will be very important in the next few months. And Dr. Chow mentioned the flu vaccine and also the COVID-19 vaccine that we anticipate in the next few months. This collaborative of community-based organizations and the healthcare agency and federally qualified health centers hopes to start addressing the issues that are rising with this pandemic in a collaborative effort. But more importantly, the API community, we don't speak a singular language. We are diverse, we're large, we're dispersed throughout the community. So we know one organization or one singular effort won't address all of our needs. And so I want to just take a moment to many of you who are partners on the group, thank you. And we are looking forward to moving the needle in the next few months.
Thank you so much, Ellen. Really appreciate it and appreciate your leadership, especially on the mobile testing strike team. I think it'll be so important to have more test sites and test sites that are available where any Asian American or Pacific Islander or anybody would be able to go to the grocery store or go to a community site and know that they have a place that they can go that they're familiar with to get tested. So our next speaker is going to be Dr. Karthik Ramakrishnan, but he may still be, I think he is still on another presentation. Karthik is so popular, he's come out with multiple studies recently. And so we're in between his, his presentations and his also his media tour. So while we wait for Karthik, I don't think he's on, we will move on to, we'll come back to Karthik once he jumps on, and we'll go on to our two community leaders who are going to be talking about civic engagement and census and why it's so important. So I'll go ahead and start with Priscilla Wong. And Priscilla is with National Health Law Program, but she's also a board member of Asian Americans in Action. And so I'd like to invite Priscilla to speak.
Thanks so much, Marianne. Hi, everybody. Thank you for the slide. So I am here to try to talk about and make the case for why civic engagement, being involved with our community, with our electoral process, with the census, has as much to do with our health as a community and as individuals as anything else going on these days, even during the pandemic. And the message I really want to bring home is, civic engagement is good for your health. So much so that for folks who are familiar with or might have heard of the Healthy People 2020, Healthy People is our national 10-year blueprint for improving our nation's health. In the 2020 version, there's an acknowledgement that civic participation, health and well-being are all key components of our one of the social determinants of health topic areas. And it's recommended that civic engagement be included in the next iteration for 2030. So even at the national level, there's certainly that acknowledgement. And there is a lot going on right now. It's in a pandemic, and for Americans in particular, many individuals throughout the nation have stigmatized and attacked as in these racist and xenophobic attacks on Asians and Asian Americans, perceived as being the source of the coronavirus. We've got that going on. We have, Asian American workers are disproportionately represented in fields that have high contact essential jobs that also place them and their families at greater risk of COVID-19. And we also know that Asian-owned businesses are overrepresented in sectors that have been the hardest hit by COVID-19, both early on because of some of the discriminatory associations, but also they've continued to sustain some of the worst economic effects from COVID. So why does that matter in the health context? Because we can change these things through our community and through individual engagement in the process. We can we can get involved, for example, with the elections. The elections are not canceled. We have influence over who gets elected into office. And that also is an important and key factor into who gets appointed into many of the agencies that we work with. We can advocate that more Asian-owned businesses become eligible for and receive PPP loans, for example. We can demand that policymakers implement initiatives that address the racism and anti-Asian violence that have been impacting our communities, and also to prevent mental health services and community support services for people who've been affected. The census is definitely a key action item for all of us. We should all be participating and encouraging everyone in our families and in our networks to complete the census form. It probably goes without saying, hopefully for this audience, but just to highlight a few examples of how the census, again, is also good for your health. We use the results of the 2020 census, of every decennial census, to help federal, state, local, and tribal health officials to plan funding for healthcare services for the next decade. Hospitals, healthcare clinics, healthcare programs such as Medi-Cal and Medicare are among many of the publicly funded and healthcare service facilities that also receive public funding. All of these use population statistics from the US Census Bureau to help plan and build new hospitals or to expand clinics and services. The statistics from the 2020 census will also inform how billions of dollars of federal funds are allocated every year for critical public services, including schools, libraries, emergency response, our infrastructure, all of these things. And then of course, Karthik, when he's on, will be talking a lot about ensuring a lot of really incredible data and the source of that data from various federal health surveys and from the census and from the American Community Survey, which is also administered through the US Census Bureau. All of this is coming from our obligations to complete the census and where we get the demographic data to know and understand disparities in racial and ethnic health outcomes, in health insurance, in income, and in housing. So all of these are incredibly important measures. I'll hand it off to JP to talk about our to-do list.
Oh, please.
I was actually going to have us go back to Karthik. He's on now because I thought it was a perfect segue, and then have us finish off with a big call to action by JP, if that's okay. Okay, thank you so much. And thank you so much. I wanted to invite Karthik Ramakrishnan from UC Riverside to speak. And Karthik, thank you so much for joining us. I know you're in between speaking engagements, and that's how important it is for us to have him here, because the data and the research that he does on a national and local basis really helps us to inform what we should be doing around COVID and census and civic engagement. So I'd like to hand it off to Karthik, who I know is going to be sharing his screen with us as well to show us some data. So thank you.
Great, thank you, Marianne. And are you able to see my screen?
Yes, we are. Thank you so much, Karthik.
Of course. So let me thank you all for having me here, and especially a lot going on today. We just released a survey earlier today. We did a study on API philanthropy yesterday, and have two other things, two more presentations yet to go. Really honored to be here with you. I want to talk about some of the tools we have. First, I want to take you to API data. Let me zoom in here. This is a smaller zoom than I anticipated. Okay, so if you go to our main page, we have a lot of resources here. One, I'll just point out in terms of COVID-19, we do a lot of sophisticated work, and sometimes it's also very simple work. Sometimes the simple work is taking data that other people have compiled and make it just visually appealing and just dead simple for people to get it. This is data based on the Marshall Project's analysis of CDC data that shows excess death across various states. Because prior to that, the narrative and the conception that most people had looking at the cause of death data at the county level, which we know is difficult to do, and there's a lot of gaps there, but the cause of death data didn't necessarily point to any disproportionate effect on Asian American communities. Some of them did show disproportionate effect on Pacific Islander communities. But what the Marshall Project did is look at the excess death ratio. So comparing the deaths this year compared to the prior 5-year average. And what they found was there was indeed a disproportionate increase among Asian Americans. And so when you look at it in the US and you look at particular states, including California, you see a much higher increase in terms of disproportionate deaths for Asian Americans than for non-Hispanic whites. And this shows you the various states where this is true: California, Florida, Georgia, Illinois, et cetera. What you'll see is that we didn't do the original analysis. In some ways, you could say even the Marshall Project, mostly the CDC did the analysis for them, but they didn't have as much of a, and it's a powerful tool that they have created, but what we did is we created infographics that can convey that information in a more distilled manner, in a focused manner. And we've had a lot of our state partners push that out. Another tool we have is a census planning tool. Since we just talked about census, I'll go back to the main page here. And if you go to census maps, you'll see what we built. We built this earlier this year as a census planning tool. And later, it's been really good in terms of looking at census response rate by tract. We have it by county. We also have it by census tract for the 20 largest metropolitan areas. And Orange County is part of the Los Angeles, Anaheim metropolitan statistical area. So let's, hopefully my computer won't die as I'm trying to run this. LA, Long Beach, Anaheim. So you click on this. And what you'll find is we have data both for Asian Americans and Pacific Islanders. And it's almost like a work of art, right? This is almost like a Jackson Pollock kind of painting. You click Explore the tool. And it's going to take a second to load up here. By the way, if you're not running Zoom, this should load up faster. And you can load it up on your phone. Sunny Shao, who is the graduate student, one of two graduate students in our PhD program working at API Data, she has built up her skills in ArcGIS tools from Esri over the course of the last year, including on census work. And what you see there, first of all, while we're waiting for these dots to render in, is that the green shades show you the census response rates in the response rates in the census tract. What you see in terms of the dots are the default view is the largest Asian American group within the census tract. And if you look at the legend, different colors mean different groups. So, many of you in Orange County wouldn't be surprised to know these are the Vietnamese heavy areas. For example, these are the Korean heavy areas in Fullerton. And then you have other groups, interspersed, including the Chinese American population over here in the Irvine area, that they're the largest group. But you don't have to just look at the largest group. You can turn that off. First of all, if you turn that off, that shows you the census response rate by census tract. And then you can turn it on for any particular group. In fact, let me turn off everything. I'll turn on census response rate in circles, because what we have in terms of different groups, so say you want to look at, say the Filipino population in terms of their share of the total population. You can turn that on. So those will be color layers, and then you can zoom in, right? And then you can see, whoops, I have to move over into Orange County. But you can zoom in, and at a very fine grained level, you can look at where those higher Filipino concentrations are by census tract. And you can click on it, and it'll give you information about that census tract. So this is a census tract in the Costa Mesa area. Census tract number 638.07. And there, the population there, it's only 199 Filipinos. It looks like it's a pretty small census tract. Filipinos are 32% of the total population there. And the census response rate, which is one of the other tooltips, will show you what the census response rate there is. 67.2% of residents responded to the census questionnaire. So that's a good visual way. Most people don't know census tract numbers. And this is a way not only to be able to drill down, but to actually look at different members of our community and have tailored outreach strategies. Okay, I see a beach ball spinning. Hopefully that's not a major issue. We have just now testing out more generally other maps we can do. So for, again, for the LA metro area, we're trying to see if there's other kind of health vulnerabilities that we can map on now that we've built the census mapping tool. And so when you go to LA metro here, go to the Asian, we have it both for the Asian American and Pacific Islander community. Click on Explore Tool. By the way, a lot of this data is publicly available data. What we specialize in API data is to, even though I'm suffering from some bandwidth issues, trying to run both the Zoom video as well as all these various applications I have open on my computer, this loads up pretty quickly if you try it on your screen, at home. And what we have here, again, is the largest Asian American group. But in terms of the layers that we have, so we have the census response layer, but we have other layers that we've added. So let me see, I'm pretty sure that this is the map that has it. Oh, you know what? I need to go back to my team. I'm pretty sure, I hope this is not the same. This might be the same map that I pulled up. I'll need to go back, but anyway, so we had a version of this. Oh, here we go. Okay, here's a county level. I believe we had it for the census tract as well, but the link must be sending it to the other map that we have. But at the county level, we have a map of vulnerability based on age and other factors like disability status for Asian Americans and Pacific Islanders. And when you drill down, you're able to do that at the county level. But I'll send the resource back. We should have this at the census tract level as well. I'll just show you what we have in terms of the layers. 65 plus for Asian Americans without health insurance. We have 65 plus with disability, 65 plus below poverty, as well as the senior population more generally. So we have that at the county level. We do have it at the census tract level for Los Angeles Metro, including for all the census tracts in Orange County. My apologies that with this real-time demo, I wasn't able to find that map, but that is some of the capabilities we have. And we believe that not just data, but visualization is incredibly important to make sure that we have the right kind of planning, and also we have the right kind of community engagement to have targeted efforts and to make it as accessible as possible to a wide variety of audiences, not just decision makers in government and philanthropy, but community organizations as well. So I'll leave it at that, Marianne. I don't know if you had any other thoughts or questions I should clarify on, but hopefully that was helpful.
Thank you so much, Karthik. That was great. I love data, and the mapping was excellent. And you had told me before that the census data with the population was based on 2018 census information. Is that correct? I don't know if Karthik can hear me.
Okay, yeah, I've gone on mute. It's the 2018. It's the 2018 5-year file. So of course, once we get the 2020 census data, we will, and I think my camera just kind of froze. So, all sorts of tech issues here. But the 2020 census data, once those are out next year, we will of course update it with the 2020 population numbers. But that's the 5-year 2018 file, which is the best we can do in terms of getting data at the census tract level.
Thank you so much, Karthik. And if I put into the Facebook, but you can go to aapidata.com to see all of this information, the mapping, the data. Also, Karthik and UC Riverside and his team there with API data. They also do a lot of different research reports, and he's actually in between releasing. He released one yesterday, he released one this morning, he's releasing one at 4:30. So just thank you for fitting us in. We really appreciate it.
Really appreciate all of your leadership, Marianne. And I think this is being recorded, so I want to come back and listen to the prior speakers too. And if there's anything we can do at API Data, we build a lot of these systems so that it can be used across the country by a wide variety of partners. We can do custom things too, so just let us know. We're happy to help.
Thank you so much. We really appreciate it.
Thank you.
So next, we are going to finish up with a bang up speaker and person who is going to give us a call to action, and with Jonathan Pake, who is Executive Director of OSET, the Orange County Civic Engagement Table, who's going to talk about why all of this information is so important, why data is important, why we need to vote, why the census is important, and what OSET is doing right now, especially during this time during COVID. So I'll hand it off, JP.
Thank you, Marianne, for such a kind introduction. Hello, everyone. My name is Jonathan. Most folks call me JP. I'm the Executive Director of the Orange County Civic Engagement Table. I'm excited to be able to share today. I think for us, one, to be able to praise all the speakers who were speaking before us. I think they had shared such valuable information. So very excited and happy to be able to listen to that and listen to their wisdom. And I'm here today to be able to actually share with folks the importance of the election this upcoming November. I think amidst what we're facing in COVID, and as well as being able to ensure that our communities are represented. This year is actually unprecedented in the sense that we're actually trying to be able to increase access to voting and voter access, specifically for communities that are hardest to reach in a time when it's actually going to become very tricky to be able to actually encourage folks to be able to vote this coming November. We find that there are changes and there's a lot of inspirational changes that are actually happening at the local level with people and communities that are offering their spaces time to be able to actually offer their own space to be for voters to be able to access as a vote center themselves. So things to be able to remember in Orange County for folks to be able to vote. One is the fact that this year, because there are precautions to be able to take to be able to vote in person, vote centers will now be open 5 days before Election Day to be able to encourage early voting. And what the Orange County Registrar of Voters has made very clear is the fact that there is a need for trusted community messengers to be able to actually come as vote center workers, to be able to actually come in and be able to work in person. Because what we are finding is that there is going to be a disproportionate number of people across the county that are going to that are still planning to be able to vote in person, even with vote by mail integration happening from this primary election, to be able to actually be accessible to everyone. So one is the fact that if folks know anyone who is actually willing to be able to be a community worker, to be able to, especially for folks who are providing in-language resources, I think that's number one for folks to be able to have access, like to be able to encourage folks to be able to spend 5 days to be able to help folks to be able to vote. Number two is the fact that we're anticipating and asking folks to vote early. It's going to be an unprecedented amount of time. Even though Orange County, this is our second time going all vote by mail. So it is fortunate for us that we have done this before at the county level. There's going to be a lot of people who are going to be voting for the first time by mail. This will be the first time that they're actually getting trying to be able to voice their opinion, given what has happened in the pandemic and how it's disproportionately impacted Orange County. And there's going to be a lot of people who want to be able to to lift their voices and be heard and to be able to advocate. So I think for us, like number three, like there's gonna be a lot of assistance and support needed for that. Number four, like educate people about the ballot and the fact that if they're voting for the first time, just be able to vote on the things that they really love and care about. This is arguably this year one of the most important ballot measure slates that California is going to be exploring this year, alongside a series of candidates that will determine the likelihood of what it means to be able to recover from a pandemic moving forward. And what it means for us to be able to have elected officials who respond to who we are and what it is. And so for us, like for all our community members who are really thinking through what it means to be able to vote this upcoming election, have community members really vote their value of their choices and what they believe is right, because this year is the year to be able to do that. And we really believe that this is a turning point for us to be able to really see what it means for community representation to be really represented at scale. And I think for us, we really believe in everyone. It requires a collective responsibility of each and every one of us to be able to see that through. And specifically for API communities, as we continue to be able to expand it. And I myself, as a second generation Korean American in Fullerton, California, I know what it means for me to be able to engage my family, my friends, and my mother and my father who, what it would mean for them to be able to vote this upcoming election and what it means to be able to do that safely and well and in an informed way. And I believe in everyone around this room to be able to actually accomplish that as well. So I think for us, just please remember the dates, encourage everyone to be able to volunteer their time or to be able to offer their time or refer people's names and to be able to ensure that folks know how to vote. This is the year where folks are gonna have to figure out and navigate swift changes immediately and from there on. And what we believe is that with community messengers like us, that we're gonna make that possible. So I appreciate everyone's time and effort, and I'll pause there and hand it back to Marianne.
Thanks so much, JP. That was great. Really appreciate that. And your call to action to get out and to vote, to complete the census. It's vital. And, and today we had an excellent group of speakers, and we're so lucky to have them all. But you can see that in order to address COVID-19, in order to address a pandemic, you need everybody. You have to work in partnership with several organizations. You got to work, in partnership with the County of Orange and the healthcare agency, and also in partnership looking at census data and research. And we also have to have a voice by being civically engaged. So I appreciate every one of the speakers who took their time today to really support us and participate. So we wanted to open it up to questions for our speakers. I know that Karthik had to leave, but this is a chance. You have Dr. Clayton Chow, who is our county health officer, as well as the director of the healthcare agency. You don't get a chance like this to ask questions to him directly, as well as you have amazing speakers. So I think we have a question. So we already have a question from Facebook Live. So I'm going to go ahead and read that. And this is either for JP and Priscilla or both. What are the biggest challenges and obstacles to voting among Asian Americans and Pacific Islanders in Orange County? Is it immigration? Is it generations? Is it post-immigrant generations? If someone could answer that for us. And that was from Susan Liu. Thank you, Susan. So JP or Priscilla?
Sure, I can go. So I think for us, there's a few barriers that I think we identify. One is the fact that are there enough in language folks who can actually reach out to the community and actually provide education and trusted infrastructure for folks to be able to be informed how to vote. I think the pandemic has uplifted for us, specifically in other resources, that it's really clear that there is a lack of in-language access for us to be able to actually provide robust enough resources, not just in terms of print, digital, and material, but actually in conversation. What does it mean for us to be able to rely on a peer or on a colleague or on a friend or a family member to be able to actually understand how to vote and be able to feel that it is safe to vote during this time? I think that's number one. Number two is the fact that, I always share that the first time voting is always like the first day of school when you're actually going over it. So if you imagine your kids or your friends or your family to be able to do that, and it's an intimidating process for folks, especially for those who have not been participating in our democracy, to be able to do that. And when we actually see community members who are experiencing it for the first time and all speaking, predominantly English at the vote center, and if they're predominantly folks who don't look like us, that's going to be a very intimidating experience. And what we have to actually make sure and do is to ensure that folks feel confident, folks feel like they are welcomed, folks feel that they are part of this democracy, and folks can feel like they can participate in this election. And then number three for us, I think, is just the fact that we're going to have to build this culture over time. We've been building this work for a long time. I think a lot of community members have been told, a lot of our narrative has been told for us that we don't participate in the election, and that couldn't be further from the truth. We are a community that is incredibly invigorated to be able to ensure that the change that we need to see in our community is actually had. And I think for us, like, that is, that has been proven true through our legacy of our history of immigration, as well as like moving forward. So I think for us, like, those are the four pieces. I'll hand it to Priscilla just to add any additional facts additional things I may have missed.
Oh, that was awesome, JP. The only other thing I was going to add, is there are the piece that JP mentioned about the experience of voting and how overwhelming that can be, especially for first-time voters or people who are not limited English proficient. It is an intimidating process, but there are groups like the ones who are represented here on today's webinar and others who are calling in. We're here to help navigate that process and to help demystify that. Asian Americans in Action, for example, we are trying to organize volunteers to help educate other Asian Americans and BIPOC community members about the ballot initiatives. And there's so much happening. There's the candidates, getting to know them. Many of the candidates are also community members themselves. There are ways to connect to them and get to know them. They're eager to get to know community members who are interested in their campaigns as well. So, get connected with us. I consider myself still fairly new to Orange County, and the best way to understand the process and to get involved is really to build those relationships, and that's what we're trying to do today.
And Marianne, if I may chime in on what JP said.
Yes, absolutely.
Even though my presentation was on the API organizations who are collaborating, all of those organizations are trusted messengers. If you go to that task force website, they're perhaps the leading API organizations here in Orange County with deep roots and all with bilingual staff, many with first generation staff. Most of those staff have experience in civic engagement efforts, know the basics of voting, and can provide the guidance to varying degrees. And so please reach out if it's a Bengali speaker, to South Asian Network, Korean, obviously KCS, Khmer, Cambodian family, and we will have voter registration materials, what the voting is going to look like, all in language with people who look like the person asking the questions.
Thank you, Ellen. Thank you, Priscilla, and thank you, JP. We have a few questions for Dr. Chow, and I just wanted to make sure he's still available on the line because I know he's running around as well.
I'm still here.
Oh, thank you. Thank you so much, Clayton. So there's a few questions. The first question's talking about, what do you think the priorities will be for the healthcare agency for next year? Knowing that much of the CARES Act, I'm sure that the CARES Act hopefully will continue, but knowing that resources are dwindling down this year, what do you think will be the priorities and what resources will you have to cover for next year as we still go into the pandemic and possibly with the vaccine starting?
So that's a very important question. I think throughout this few months, truly the pandemic is really bad and has affected us all as a community. But I believe what it has done, it really pushed the issue of health equity to the forefront. The general chronic health condition that has been plaguing our community, and we have not been coming together as a collaboration, as a collaborative to really address it head on. I mean, historically, we have gotten data, lots of data about health condition in various groups, but we have not really sit down and as a community come together and said, here are a handful of goals that we want to achieve for the entire population and really go head on with it, with the collaboration from the private, the public, the CBO, the community clinics, and what have you. I think this is an opportunity for us to do differently, to really drive the whole population health approach to taking care of our populations. Obviously, until there's COVID-19 vaccine available for everybody, we'll still have to deal with this pandemic, and there's still basic public health functions that we have to do as is related to COVID. But what I'm hoping to do is drive our community to a different level and truly collectively come together and address health inequity in our community.
Thanks so much, Dr. Chow. Another question for you from Facebook is, we know that COVID-19 and wearing masks, and it became very political, in the area. And we know you have to always navigate that. So what type of reassurance are, you preparing to, or what type of reassurance do you have to address that we're prepared just in case of worst case scenario, as we go back to school, as the economy opens back up? What's the reassurance or background, or what do you think the healthcare agency is doing to prevent anything worse happening?
So we have several campaign that's happening right now around the issue of the non-medical intervention of this pandemic. And the non-medical interventions are face covering, wearing face covering, keeping physical distancing from people who don't live in the same household, and then not gather when it's not necessary, and then stay home when you're ill, and then the sanitary measure. Those are the basic non-medical preventive behavior that we know work. For countries have been doing a better job than everybody else as it relates to a collective group of people who are targeting and facing COVID head on. And the issue of face covering is not so much of an issue in other part of the world was in the United States. Various reasons on why this face covering has been so politicized in this country. But when you look at the data of the percentage of positivity rate in Orange County, I believe that the majority of us, people in Orange County, are actually doing the right thing. And it's a smaller group that speak the loudest that has been taking this non-medical intervention to the political arena, which is unfortunate. I've always said that the pandemic is about health, is about public health, is about the wellness of the entire community. You wear a mask to protect me, I wear a mask to protect you. And I'm hopeful, because if you look at the number can't lie. The number of positivity rate in Orange County has been doing very well, trending down. And so I'm very hopeful that as a larger collective community, we are doing the right thing. And I encourage people to continue to do the right thing.
Thank you, Dr. Chow. One more, you became really popular. So one more question. What is your response, or what did you think about the National Academy's study? They launched the study on equitable allocation of COVID-19 vaccine. I believe in that study, it didn't prioritize Asian Americans and Pacific Islanders. Did you have any response to that report, if any?
Yes, so I believe there's a draft that's going on at the national level that are asking for the citizens' input. And for those of you who wanted that draft form, maybe I'll email it out later. Locally, Orange, so as you know, California is one out of 4 states that will be at the first state will receive the COVID-19 vaccine. And I actually sit on the state a task force to make determination as is related to prioritizations and the distribution effort once we receive the vaccine. Locally in Orange County, we've started the COVID-19 vaccine task force. I know some of you are part of it. I'm looking at Fontana. He's actually part of the task force, beginning to look into forming a community well representative of all sector in the community to sit in the task force to, number one, really study the vaccine hesitancy in Orange County. Number two is to really start the conversation on the equity piece of who and prioritization of who's going to get it first. And then the third piece is the distribution, right? And so the work has started here in Orange County. I'm very excited that we have some really subject matter expert, as well as a community leader in that part of the task force. If you're interested, please let me know. We have folks from and Isabella too. Isabella Becerra is also part of this task force and community-based organization like Cambodian Family. We have academic institution participating in this, bioethicists. We have the health system representation from the older adults community, from the education, as well as advocacy groups. So we have begun. We're going to stand up a web page on the Orange County Healthcare Agency webpage, OC Health Info. And so please go into our website. I'm hoping to stand up that vaccine section soon in a couple of weeks. And so you can follow. We want to be transparent. We want the community to participate in helping us in start the conversation around a COVID-19 vaccine. Because we realize that some people could have issue as is related to their readiness to receive the COVID-19 vaccine. So it's a great question. Thank you.
Thanks so much, Dr. Chow. We have another question, and this one I'm going to direct to Ellen On. The question is, what best practices are the partners utilizing in order to get resistant Asian Americans and Native Hawaiians and Pacific Islander communities to seek COVID-19 services and related services in Orange County?
Yeah, well, the best practice that is that we all know about, of course, are the Health and Human Services class standards for CLAS standards for providing any sort of health care or health education. So of course, we're all grounded in that. All of us agencies, we're all well versed in that. But more importantly, and this has not been studied as much in the API community, but it has been studied to death in the Latinx community, is the Promotora model. The Promotora model of community health workers, trusted people in language who are embedded in the community as community health workers, really improve health in communities. And it was actually pioneered by Latino Health Access here in Santa Ana and has been studied throughout the state. And so our projects are really based on a promotora model. We can't really call them promotoras because it's a Spanish word. But our community health workers, outreach workers, they're really embedded in the communities and follow that model of trusted, informal neighbors, friends, experts, fellow churchgoers. Those are the best messengers to convey the importance of not only testing, but quarantining, isolation, getting the vaccine, all these messages that need to go out. So that is the best practice that is really, that underlies these projects. But please understand that this has been a rapid response by CBOs. Even though we are all based in that best practice model, that's something we do every day. It really, this response came together in the last month, and we are just doing the best we can in this really epical and almost existential moment we're all going through this year. This is a pandemic of the century. So we are just doing our best to make sure that our communities are well served.
Thank you so much, Ellen. And this can be directed to Dr. Chow or anybody else who may understand this. Even Priscilla, I know that you're an attorney. There's other counties who are getting their law enforcement involved in mandating masks or, fining people. A question had been, how can we as Orange County, is there going to be any focus or any support from law enforcement to help implement mask wearing, since it's one of the, primary ways to prevent the spread of COVID?
So let me address that. I've read some of the question in the chat box. Thank you, Marion Fu, and thank you for that. I want to clarify that currently Orange County has a mandate for face covering. For those of you who don't know, you can go on to the Orange County Healthcare, OCHealthInfo.com, and go on to officer order In that section, you will find updated health officer mandate. There was a questions about why I walked back on the face mask mandate in early May. At that time, you remember the CDC as well as the State Department of Public Health did not mandate a mask and only have it as a strongly recommendation. And in fact, all county in Southern California did not have a mandate for masks at that time. And there was an issue around the previous health officer and her mandate, and there was question and pushback from the community because of the inconsistency at the mandate at that time as is related to CDC and the state. And so when she resigned, in order for us to not appear as a fighting ground, I make sure that we are consistent with the state and with the CDC. So a week after that, the state decided to have a mandate on face covering, which I personally have been very supportive of it. And so currently, since then, Orange County has a face mask mandate. So just want to clarify that. As it's related to enforcement from a health officer perspective, the health officer does not have the authority to enforce a mandate such as face covering. And so we work together with city, with the sheriff department, with law enforcement, and with city manager. I have a call with the city manager and the mayor separately every week. And we talk about the issue of enforcement and the jurisdiction that have the authority to enforce this are law enforcement. And so it is not true that all sheriff department for all county have a enforcement fine, as you will, around face covering. It is based on city. So in Orange County, the city of Irvine and Costa Mesa and Fullerton are very strict with fining people for it. In LA, the city of Santa Monica, Venice have a very strict fine attached to non-compliance. But overall, the community in Orange County, the law enforcement side, specifically our sheriff department, believe in education first and encouragement first. The mask mandate from the state, which Orange County follow, has exemption. So there's a list of exemption of why people don't need to wear a mask, especially people who have health condition and mental health condition included that are being exempt from the mandate. So I would encourage, for those of you who have questions about face covering, go on the Orange County website and look at the health officer order.
Thanks so much, Dr. Chow. Really appreciate that. So we just wanted to ask one more question, and this is related to data. And you saw through Karthik's, presentation, the census data, which is key. Also, they're working on data to show disparities and needs as well. So a question that came up was, how are we using this data to really plan out COVID-19 response? How are we using data to look at getting people involved in the census and in civic engagement? Are organizations using this data for planning purposes or even evaluation purposes? And so anyone can answer this question.
I'll chime in, Marianne. I think most of us on the ground doing street level work, direct services, we're very aware of this data and we use it every day. The bigger question is, I think, is to get this data to really drive policymakers, funders, decision makers at the higher levels, because sometimes projects directed at API communities are located in places they shouldn't be. They are run by people that shouldn't really be doing the work. And so this data should drive that level of policy thinking, as opposed to the organizations. We naturally respond to need. that is our mission as organizations. And the data just confirms what the need is, the anecdotal stuff that already exists. And so I just would like to chime in that for those of you who are policymakers, please rely on the data and look at that data so that resources are well spent. And our country's going to face a tough budget next year, and we have to be very thrifty and be very targeted in how we make impact. So for those of you who are in positions of policy making, please use that data.
Thank you, Ellen. And with
Ellen.
that, we're, oh,
Marianne, for us, like Ellen said, we are the direct services provider. We use a lot of that data. We're so grateful for that disaggregated data to try out targeted outreach and education for the population. For example, the Cameroon community, we know that there's a large number in Santa Ana and Anaheim. With that data, we have just realized that there is a pocket in Costa Mesa that we have never known before. And we just want to make sure that our outreach and education effort targeted based on that data. And then in addition to what Ellen has said about best practices, one of the best practices that we've been using right now for our COVID-19 outreach and education is the targeted outreach and education and messages to the community. We know that the speaker have mentioned that our API community is so diverse that we collectively as an API COVID-19 task force has over 200 years of experiences observing the community. We put that experience together, but they also are diverse experiences within each community as well. With that, for example, like us, we outreach a lot over the phone and making sure we still continue to build trust, and then they close. And now we're able to have a family of 4 who had been living in the shadow with COVID-19 come out and tell we need support. So those kind of trusted messages that Ellen has said is very important, and that trusted messengers are not possible without the experiences of the community-based organization that have built over years. For example, our API collaborative that has over 200 years of experiences together. Thank you.
thanks so much, Vatana. Really appreciate your comments. So we're going to be closing the session right now, the town hall. We really want to say thank you to everyone for participating. But before we close, I just want to ask if any of the speakers, if all of the speakers could actually just give a brief comment on what you hope for us as a community. Or I'll start with Ellen.
Marianne, maybe it was my internet connection, but we lost the final sentence of.
Oh, okay. I was asking if there's any last comments that the speakers want to make about us all working together to address COVID-19 during this time for the community.
Well, I mean, I think there's no one on this Facebook Live or on this Zoom who doesn't want COVID-19 to just end. Return back to normal. And a virus knows no color. A virus knows it's a collective and not a singular effort. It is to spread the gospel of physical distancing, mask use, all the advice that we hear, hand washing, not just ourselves, but encourage those we love and those we can influence to do that. And of course, early identification of positives to prevent and isolate is critical. So as this testing rolls out, anybody and everybody who needs and wants testing, please come and get tested. It will take a village for this nightmare of 2020 to end. And I think we all have to play our part. Nobody's more important than another person in this pandemic. And so we are all influencers in our own right. And so that's my final message to everybody.
Thank you, Ellen. Do any of the other speakers have any final messages?
I would want to take this opportunity to remind us that unfortunately it takes a pandemic for us to pay serious attention to the inequity of health and other social determinant of health in our community. But I'm very hopeful that together, public, private, academic, as well as advocacy group, that we will be able to make a big difference for those vulnerable in our community. So thank you all.
Thank you, Dr. Chow. Priscilla or JP, any last message you'd like to say?
I think, you know, as folks have talked about, COVID-19 has really exposed all of the ways that our Asian American, Native Hawaiian, Pacific Islander, and other BIPOC communities are affected by structural racism and inadequacies and deficiencies in our health and healthcare systems, and in our in all the ways that we interact with public agencies and public systems. However, what is also true is that all of our communities have survived and endured over the decades and centuries because of what we're doing now, because of, you know, working together and being in community. And, you know, I really give a lot of credit to Marianne and Ellen, because every time there's an opportunity that comes up, they are the first ones to say, you know, we don't have to be doing this ourselves. You know, let's bring in all of the other groups involved, and we can do a better job and reach more people. That takes a lot of coordination. So I appreciate their leadership very much.
Thanks, Priscilla. Any last words, JP?
No, I think, you know, for our folks, you know, I think right now, just, you know, similar to the call to action, let's use this opportunity in November to be able to really have that voice be heard for the first time, and really think about how that actually creates a legacy for what it means to be, for us to be able to change the way of how we participate in our democracy. What it means for someone to not only step into the poll, the vote center for the first time, but also to be able to actually step into their city hall for the first time and feel confident that their voice matters. And I think for us, like, that's really, for us, like, I really see this as right now as like as a door that's being opened, and let's just make sure that we believe that our families and friends should be there. So that's my last word.
Thank you, JP. So thank you so much for everyone for joining us today. If you are on Zoom, you can fill out our evaluation form so we know how we can improve the next session. And on behalf of our entire collaboration today, you know, all of the partners you see listed, we just really wanted to thank everyone for joining. We also have Vivian Cao from Senator Ling Chang's office also wanted to send out a thank you to the group for speaking today. And then finally, I just wanted to say, you know, this is just the beginning, and our call to action was to continually work together, because we know that, you know, next year, hopefully a vaccine will come out. We know we need to make sure that our communities have access to, you know, the vaccine, as well as to other resources that are coming from the CARES Act. And so we're all still working together. We need to really advocate for each other and for all communities. And finally, please complete the census. We have a 75.6% response rate, self-response rate in Orange County right now. Do not forget to vote, as many of our speakers have said. And finally, as Dr. Chow said, please get the flu vaccine if you can. It's really important. We want to make sure our communities and everyone here is healthy. So again, on behalf of all of our partners, we thank you so much for joining us today for our town hall, and we bid you good night. Thank you.